under better circumstances and under happier times, and hopefully that'll come in the next few months. But right now, the goal of my presentation, and I know the Division of Industrial Relations, is to give you the most up-to-date information that we have, and obviously to give you information about providing your employees with required paid leave under state law and federal law, knowing that these situations and the guidance is changing day by day by day. And so we're, again, going to try and give you the best information that we have, but just know that things can change. And some of these questions, I'm going to give you, my best advice based on what I've been told, not only at the state level, at the federal level, but again, know that some of these things could change. So we'll go ahead and get started, jumping right in. And Chrysalyn, if you could go to the next slide. So how did we get kind of down this road and where we're at now? So in early March, I started to see the signs, obviously, that this whole situation was progressing in a way that there were people that needed to take leave and get out of the office. And at that point was when we started hearing the word quarantine. So this was back in March 11th. So I issued a directive back then saying that if there was any employee who was subject to any type of a government quarantine, that they should be allowed to be out of the office and that they should not have any paid leave taken away from them unless it was a voluntary situation. In consultation with the governor's office and with some of the public health officials, again, this was put out on March 11th in advance, knowing that some of these situations were going to present themselves. So this was the first bulletin that came out from the labor commissioner. Fortunately, we are not at that point yet where we are under a government quarantine, and I will get to that in a little bit later. But this was the first directive that went out, and obviously with the new paid leave law in Nevada, Senate Bill 312, that took effect on January 1st, 2020, there were employees who had paid leave that they could use. And so that's why this directive was put out. It was a voluntary use of leave. It wasn't a forced use of leave. And again, if they were going to be subject to any type of quarantine, they should not have any of that leave taken away. So go ahead, Chrysalyn, and go to the next slide.
Okay.
So the next kind of phase in how these events rolled out was the governor then issued a directive about essential and non-essential businesses. That started on March 17th, and that first rollout of what was essential and what was non-essential led to some confusion. So our office issued this directive based on the governor's directive of what was essential and what was non-essential. The audience that we're talking to today is construction, so you are deemed essential. So again, that was put out on March 17th. Go ahead and go to the next slide, Chrysalyn. So that was clarified again on March 20th, and the big clarification on that was that local governments are now in charge of enforcing that. There was a lot of confusion that the labor commissioner was going to enforce those provisions. That was not ever intended to be the case. So that was clarified on March 20th, 2020. And so let me just make a point here very, very quickly, because we're getting a ton of questions about this. And it kind of leads into the federal paid leave and federal paid sick leave issues and requirements. So we are getting a lot of calls from employees saying that my business is essential, but I am scared to go to work. So with the new stay-at-home order that the governor issued yesterday, simply being scared to go to work is not enough. And it's not enough under the new federal rules, and we'll get to those, or even the state rules. There is no formal government quarantine in Nevada in any location at this point. There is a stay-at-home order. However, if you work for an essential business and you do not have any of the elements relating to COVID-19 that will allow you to either use the federal paid leave or the federal paid sick leave, you are required to report to work. And I certainly appreciate and don't want to diminish anybody's feelings about being scared. I mean, all of us personally, I'm sure in our own lives, have our own feelings about some of these issues. However, if you work for an essential employer and you do not have any of the conditions or any of the other requirements to take the paid leave or the paid sick leave under the federal law, you are required to report to work. Now, your employer has the option of granting you paid leave under the state law or granting you leave without pay. I wouldn't recommend doing that if I was an employer, because obviously you're losing an employee. But just being scared to come to work is not enough to qualify for the new leave provisions under federal law. So under Nevada law as well, it is an at-will employment state. And I certainly would absolutely discourage, and I've been telling employers, you know, you need to be a little bit flexible here given all of the events. I wouldn't simply fire somebody or lay somebody off because they're, you know, scared about the situation or they're confused about all the orders that have been issued. But as an employer, you do technically have the right to terminate employment if somebody is not coming to work. And again, not qualifying for any of the protected leave under federal law or state law. So that is happening. It's very unfortunate. I would suggest that if you are going to do that as an employer, you need to document, because potentially when we get 2 months or 3 months down the road on some of these issues, I anticipate that there will be claims and complaints saying that I was not provided leave and I should have been provided leave, or I was let go for reasons that I shouldn't have been let go. So again, document. But as of now, and even based on the governor's order yesterday, if you work for an essential employer, you are required to come to work unless you meet some of the other requirements for the federal paid leave. So go ahead and go to the next slide, Crystalline. So this is just some general information, and again, a good reminder for Nevada employers. We put this out again early March, that there is no suspension of the Nevada employment laws, and there will be no suspension of the Nevada employment laws. So right now what we're seeing is a lot of employees are being terminated. If you are terminating an employee, they have to be paid within 3 business days. We are now seeing, unfortunately, a lot of claims and complaints where that is not happening because employers are starting to not make payroll. So unfortunately, those claims are still being processed by our office, and obviously we will go through the process and address those situations on a case-by-case basis. We also know that some businesses are closed right now, so again, we'll have to handle that on a case-by-case basis. But there's a couple things I want to point out really in Nevada law, that you cannot decrease an employee's pay unless you give them 7 days written notice. That is interpreted as 7 business days notice. So again, getting probably 15, 20 calls a day from employers saying, I need to cut the hourly rate of my employees. How can I do it? Can I do it tomorrow? Again, the law says you can't. Now, I truly understand that some employers are going to do that anyway because they're trying to pay the bills and they're trying to keep things moving. But technically, under Nevada law, you have to give 7 days written notice to decrease somebody's pay. On the insurance side, and this gets into insurance law and the division of insurance, but if you are providing insurance benefits under Nevada law, if you want to cancel those benefits, you have to give 15 days notice to the employee. So again, the labor commissioner certainly appreciates that many of these situations are becoming urgent, they're becoming instant, but according to the law, there are still time periods and notice requirements that employers have to meet. So again, when you're thinking about, am I going to lay somebody off or am I going to furlough them? When you furlough somebody, they are technically still an employee. So those issues of providing insurance, providing workers' comp insurance, having them on a telework situation, essentially you are still an employer. So again, what I have been telling employees, and employers over the past couple of weeks is there's a lot of employers who are saying, well, I'm just going to furlough everybody and only have them work like 3 hours a week, and I'm not going to lay them off. We are kind of at the point, and again, this is a business decision, but we are kind of at the point where you need to decide, am I going to really furlough somebody because I want to get through this and I know that I'm going to be able to bring them back? Or am I going to lay somebody off to allow them to start getting into the unemployment system? So if you haven't seen the news this morning, and if you didn't see the news last week, the unemployment rates are going through the roof. In Nevada, they are going through the roof. The process to apply for unemployment is taking an extensively long time because the system is overloaded. So the sooner you make that decision to allow that employee to start applying for unemployment and to get in that system and to start the process, the better. The CARES Act that was signed by the president last week is enhancing and expanding unemployment benefits. So again, these are the decisions, again, business decisions that you will have to make, but I would not recommend furloughing everybody or keeping somebody on a furlough just because you don't want the unemployment sting that comes from being an employer. This is the time, unfortunately, when those decisions probably need to be made, and you need to make the decision, am I going to furlough somebody and keep having to pay health benefits and have that responsibility, or am I going to lay them off and allow them to go get unemployment? Now, in 3 or 4 months, if things pick back up, you can always bring that employee back. But I would not recommend being trapped in that world of, I don't know if I want to furlough, I don't know if I want to lay off. Make a decision and make it quick because, again, the unemployment system at this point, I mean, if it keeps going the way it goes, the processing of claims could be weeks, it could be months. So I just am pointing that out for all of you. And again, that's not an easy decision to make, but I would recommend making that as soon as you possibly can. So again, the minimum wage has still stayed the same, $7.25 if you're offered health benefits, $8.25 if you're not. The interesting thing is the minimum wage is set to go up July 1st, 2020, and we'll talk about that later when we get to June and July. But as far as the basic Nevada labor laws, again, those have not changed and they are still being enforced. But again, Nevada is an at-will employment state, so you do technically still have the right to terminate an employee for no reason and without notice. So go ahead and go to the next slide, Rusalyn. So again, I kind of mentioned this, reminder about Nevada labor laws, postings. You still have to have the required postings in your offices, still have to comply with Nevada labor laws. Again, businesses that are closed, we will consider granting extensions for responses and potentially the issuance of paychecks. Again, don't want to put that as a formal pronouncement because unfortunately with these types of situations and events, there are people that will take advantage of these events, and we're already seeing that on the labor commissioner's side, and that's very unfortunate. But again, that's why the labor commissioner has said that there is no suspension, there is no no non-enforcement of Nevada labor laws at this point. So just to make that clear for everybody. The one thing I would mention about payroll and paychecks, and again, this is outside of the jurisdiction of the labor commissioner. This is the new federal law that rolled out. There is something called the Paycheck Protection Program that is now being administered through the Small Business Administration. There's some really good information on that on the U.S. Chamber of Commerce website. If you are in a situation where you are concerned that you may not be able to make payroll a month or 2 months down the road, I would recommend that you look up that program and again start that process now, because I was on a conference call yesterday with the Federal Department of Labor and that rolled out on Monday, and they already had received over 100,000 applications alone in like an hour for payroll protection program funds. Again, just mention that because that's something, again, the quicker you apply for that, the faster you're in the queue and the faster you may be able to get those funds. So go ahead and go to the next slide. So the new House Resolution 6201, Families First Coronavirus Response Act, known as FFCRA. So this law became effective April 1st. There was some confusion about when it was going to become effective. This is the new federal paid sick leave law that grants employees who meet the elements of the law up to 80 hours of paid sick leave. So let me make clear right up front, and I've been on several calls with the Federal Department of Labor, this is not a catch-all paid sick leave that anybody can use for anything. This has very, very specific conditions on how it can be used. So looking at the slide, if you look at number 1 through number 6, those are the requirements to use this leave. You don't have to have all of them. You just have to have one of them. So again, I mentioned it earlier, the employee is subject to a federal, state, or local quarantine or isolation order related to a COVID-19. So the unfortunate perfect example of that is those folks that were on the cruise ships in San Francisco that were truly under a government quarantine and told not to come ashore until they were checked out. As I stated, in Nevada right now, there is no formal federal, state, or local quarantine. That has not happened yet. There is a stay-at-home order, again, for non-essential businesses and individuals that don't have to go to work. But as of now, there is no formal government quarantine order in Nevada. So the second one is the employee has been advised by a healthcare provider to self-quarantine due to concerns related to COVID-19. There's guidance on this as well, that obviously in a perfect world, the employee would have some type of documentation from the healthcare provider saying, I'm telling you to stay home because you have symptoms of this. As an employer, you definitely should ask for this, but you also need to know that during this time that many of our public health professionals are literally working 24, 48-hour shifts straight. So getting documentation and getting notes may not be as practical and reasonable as it has been in the past. So you need to be a little bit flexible on this one. But again, if somebody comes to you and says, my doctor told me that I need to self-quarantine, my recommendation to you is you need to grant them this paid sick leave under the federal law. So the third one is the employee is experiencing symptoms of COVID-19 and seeking a medical diagnosis. Again, if your employee comes to you and says, you know, I'm having symptoms, I need to go to a doctor, my advice to you is, again, allow them to use this paid sick leave under the new federal law to go and get that diagnosis. Certainly, again, there might be individuals who could potentially take advantage of this. We can't capture, you know, that whole universe, but as an employer and just given the health nature and the seriousness of all of this, I would recommend that you absolutely allow them to use the paid sick leave available under this law for that. I'll kind of mention too that the leave, it can be, we'll get to the next one, it can be intermittent under a certain point. So 4 and 5 is when the leave can be intermittent. So the employee is caring for an individual who is subject to an order described in 1 or 2 and has been advised to basically stay home and self-quarantine. So number 5, the employee is caring for a son or daughter of such employee if the school or place of care of the son or daughter has been closed or the child care provider is unavailable. So under number 4 and 5, the paid sick leave under the new federal law can be intermittent. So that means you could take 8 hours one day and then take 8 hours another day. The guidance from the federal government on the first 3, where somebody actually is under an order, a quarantine order, or they've been advised by a healthcare provider to stay home because they have symptoms, or they're seeking a medical diagnosis, the guidance from the Federal Department of Labor is they should take the leave in the 80-hour block for those first 3 conditions. And the reason for that is because of the health nature of it, and if they possibly have COVID-19, there's no reason to have them back in an office for a period where they might be susceptible to getting other people sick. So number 6 is kind of a strange one, and there's no real guidance on this yet from the Federal Department of Labor. The employee is experiencing any other substantially similar conditions specified by the Secretary of Health and Human Services in consultation with the Secretary of the Treasury and the Secretary of Labor. That hasn't been defined, and it hasn't been really fleshed out as far as what that's going to mean, and that may come up later. And again, if that does, I'll provide guidance to AGC on that. So the federal paid sick leave is a separate leave bank now. It is separate from state law. So employees are now entitled to utilize their state paid leave if it's available, and then they are entitled to use the potential 80 hours of paid sick leave at the federal level. So how this is going to work is the employer will provide the leave to the employee, then they have a right to be reimbursed by the federal government for the days and hours that that employee was out. So they capped it at $511 per day. So in a maximum of $5,110 in the aggregate. And if it's conditions related to the employee not being able to go in because they have to care for another individual or they have to care for a son or daughter, that is capped at 2/3 of the salary. So the cap is $200 per day and $2,000 in the aggregate. So I know there's questions, and I've received some questions about, well, what if we have a collective bargaining agreement? How does this work under the collective bargaining agreement? So the way state law and federal law works is a collective bargaining agreement can technically have greater benefits. Usually they never have less benefits than state or federal law, but you can obviously have more. The issue of, the pension contributions, the trust fund contributions, I would recommend continuing to pay those. Again, I would consult with your trust attorneys and with, where those funds are going. But as a labor commissioner, I would recommend that you continue to pay those. How this is going to work in a practical manner, the Internal Revenue Service is developing the forms now for employers to fill out. But again, how fast this hit and how fast some of these laws were passed, there is going to be a little bit of a delay in getting the mechanical structures in place and getting the forms in place. So as an employer, as of April 1st, yesterday, employees are entitled to start taking this leave. When you might be compensated by the federal government for them taking that leave, I don't know. And again, I think everybody needs to be realistic and practical here that the federal government now has $2 trillion that they need to get out and get out very, very quickly. But again, that is going to have some potential bumps along the road. So just know that and just be patient. But I can't emphasize enough that this paid sick leave now, you have to have one of these conditions to take it. It can't be, again, that I'm scared, I don't want to come to work, I think this, I think that. It has to be one of these particular reasons to be allowed to take the paid sick leave. So there were some exemptions that were written into the law. So obviously if you're a healthcare provider, an emergency responder, they don't want people taking paid sick leave now because they need every person they can to man some of these facilities and to provide healthcare. So there's a carve out for those folks. There's also a carve out for small businesses with fewer than 50 people. So the catch to that is if you have less than 50 people and the requirement is number 5, where the employee is out taking care of the son or daughter, that it would create a hazard or jeopardize the viability of the business. There is a carve out there. So what the federal government has recommended is that the employer, if you have less than 50 and you have that situation where, let's say I have only 5 employees and all 5 of them have a child that's now out of school and they're all asking to take this leave, you can deny that leave. You do have to make a certified statement. Again, that will be kept in your records if there is a complaint saying that I have less than 50 employees, I'm an authorized officer of the business. I have done an analysis that if I let all 5 out at the same time, it's going to jeopardize the viability of my business. You have to certify that statement. Again, that is a statement that will be kept by the employer, and at some point, you should anticipate that when some things calm down, there might be an enforcement mechanism where the Federal Department of Labor, and they may rely on the state labor commissioner to go out to employees and employers and say, were you provided this leave? If not, why? And then we may go to the employer and they may say, well, I had less than 50 employees. I did the certification. Here's my documentation. And again, that'll be looked at on a case-by-case basis. In terms of this law and some of the new provisions, even in the unemployment law, there is a 30-day kind of a grace period that the Federal Department of Labor has granted to employers. Again, because these laws got rolled out so fast, getting the enforcement mechanism up in place on day one is not possible. So they have stated that they are giving employers a 30-day kind of good faith, good effort time period. But again, what I would say to you is if you have any employee with the first 3, where it's even in the realm that they possibly have COVID-19, err on the side of giving them the paid sick leave. So this also applies to part-time employees. So again, you're going to have to balance that out of how many hours did that part-time employee work, and again, grant them this paid sick leave based on however many hours they work, and again, then calculate the rate of pay based on the part-time rate. So I'll kind of stop here and just see if there's any questions about this particular provision about the paid sick leave. The other comment I would make about this is that this is not intended to last past December. So again, whether I agree with that as the labor commissioner or any of us agree with that, this is a temporary paid sick leave program. So it sunsets December 31st, 2020. So I've received a lot of questions of, well, am I going to have to provide this sick leave forever? Well, we'll have to find out. I mean, obviously, I think the country and the states are learning a lot of different things with all of this, and there may be new laws that come into place, not only at the federal level, but at the state level involving paid sick leave and paid leave. Obviously, with our legislature, there's always the potential of a special session. And then obviously we will have a legislative session in 2021 that could potentially address the issue of paid sick leave. Senate Bill 312 started out as paid sick leave and it just ended up as paid leave. So my guess is that next session, Senate Bill 312 will become some type of a paid sick leave bill. But again, the intention of the federal law is to have these provisions ending December 31st, 2020.
So Shannon,
yeah, go ahead.
This is Alexis. Just a couple of questions came in to clarify if an employee is furloughed, do they qualify for unemployment?
So there is a new provision under the CARES Act that if your hours are reduced by over 10%, you are potentially eligible for some type of compensation under the new CARES Act. Again, how that's going to get rolled out, I don't know. And like I said, how fast that's going to get rolled out, I don't know. But yes, depending upon the reduction in hours, there are potential benefits that are available under the CARES Act.
Okay, and then the second one that came in, what is the responsibility of the employer if the employer asks a sick employee to stay home due to illness?
So if an employee presents themselves at work and they appear to be sick, and unfortunately this is still happening, the other unfortunate reality here is there's a lot of employees now who are afraid of losing their jobs. So they are coming into work and they are not healthy. So as an employer, you have a right to ask them to leave the workplace. Again, don't do that on the basis of their nationality or their ethnicity, because we are seeing that too. That gets into more of an equal rights complaint issue. but you do have a right to ask an employee to leave the job site. And again, you do have a right, if they've already been out, you do have a right to ask them for a doctor's note to return. Again, just knowing that the flexibility here that, you know, they might be able to get those notes, but certainly as an employer, and I'm sure the, you know, Division of Industrial Relations can speak more to this, I wouldn't jeopardize the health of your other employees, you know, at the risk of one coming in sick. And unfortunately, like I said, this is still happening because a lot of employees are afraid of losing their jobs. Nevada did also pass the law this session, Assembly Bill 181, that if an employee calls in sick, you cannot force them to come into the office to prove they're sick. So that law was passed. So again, you know, there are potential abuses here, but again, I would recommend erring always on the side of protecting the health and safety of your workers. And to the extent that those workers have any paid leave available, I would allow them to use that to, you know, get over whatever they have. And, you know, not everybody has COVID-19. I mean, it's up in northern Nevada, it's allergy season. So a lot of people have allergies right now. But again, my advice is to always err on the side of keeping your other employees safe, because if everybody in the office gets sick, you're not going to have anybody to work anyway. So again, that's my recommendation.
And then another question just popped up. The 80 hours of sick leave is not reimbursable by the government, or is it? Or is there some other kind of reimbursement program? And then,
so go ahead, Alexis.
If the employee is sent home by the employer, is that the employer's paid sick leave program under state law or their own, or do they qualify for the new federal paid leave? So those are sort of.
So the only way they qualify for the federal paid sick leave is they have to meet one of those 6 requirements. So if they don't meet one of those 6 requirements, they are technically not eligible for the new federal paid sick leave. And at that point, they could use their state paid leave. But again, if somebody's coming to you and saying, you know, I'm experiencing symptoms and I'm going to seek a medical diagnosis, I would err on the side that this qualifies under number 3. And I would provide them this federal paid sick leave. As far as the reimbursement, yes, employers are entitled to reimbursement. But again, how that looks and how the process for that is going to roll out, I don't have information on that because it's done through tax credits, and that's going to be done through the Internal Revenue Service. But under the federal law, employers are eligible for reimbursement. But again, it's capped at $511 per day.
And then another one, what is the state paid sick leave?
So there is no state paid sick leave. So there is the state paid leave law, which was Senate Bill 312. So starting January 1st, 2020, any employee in Nevada was entitled to earn its 0.001923 hours of paid leave for every hour worked. They were eligible to take that after 90 days. So technically after March 31st, they were eligible to take paid leave under Nevada law. So hopefully employers were offering that and complying with the law, but that is a whole separate leave structure and whole separate requirements. And there was some exemptions to that bill too if you had a collective bargaining agreement. But again, the new federal paid sick leave and the reimbursement to the employer only applies if you have one of those 6 elements in the law. So it's not a catch-all, and it's not, like I said, it's not intended to be used for everything. This is strictly to deal with situations related to the COVID-19 situation. The other question that I've had, and I find it interesting, is, well, my son or daughter is still going to school. They're distance learning, so the school's not closed. No, the schools are closed. They are closed. So that's not a way to get around this either. They are closed, and they are likely going to be closed probably through the school year, we will have to see. I mean, I don't have a definitive answer on that, but the way things are going, it looks that way. So go ahead and go to the next slide, Chrislyn. So the other part of the FFCRA is the paid leave, the new federal emergency paid leave. And so most of you will know this as Family Medical Leave Act. They added some protections into the Family Medical Leave Act based on the COVID-19 situation and enacted some enhanced protections for job protection and also for potential paid leave. So they also added that this leave could now be used in conjunction with the 80 hours of paid sick leave. So you could have an employee technically that could be out of work or off of work for 14 weeks. So they could technically use the 80 hours of federal paid sick leave for 2 weeks and then use up to 12 weeks of paid leave under the Family Medical Leave Act. Now, the only way they can use the potential 12 weeks of additional paid leave is if the employee is unable to work or telework because the child's school again or the child's place of care is closed or the child's care provider is closed because of a COVID-19 related public health emergency. So it talks about the 12 weeks of job protected emergency paid leave. So how the federal government envisions this is, again, the employee would use the 80 hours of paid sick leave at the front. And then if the situation and conditions continued, they could then apply for paid leave under the Family Medical Leave Act and potentially be on paid leave for 12 weeks. Now, again, the leave is capped and the wages are capped at 2/3 of wage replacement, up to $200 a day and $10,000 total. So again, this question's come up a lot. So I could potentially have an employee off for 14 weeks. Yes, you potentially could have that situation. Again, the employer and employee obviously have to communicate, and the employee under the Family Medical Leave Act still has to submit all the paperwork and get the required paperwork and doctor certifications in for paid leave to be granted under the Family Medical Leave Act. But this is kind of the second step of how the federal government envisioned rolling out this leave. Is obviously the first part of the leave is to address the conditions and the medical side. This side is now to address the family side, which is why it's under the Family Medical Leave Act. So again, if an employee is out on this type of leave, they have job protection. So you cannot fire them while they are out on this type of leave. People will do it. And again, those are potential legal issues that down the road you may have to deal with, but they did write into law that there is a right of job restoration if you're out on this leave. Again, the exception for employers, now this one is a little bit different. It's an exception for employers that have fewer than 25 employees. So again, how that would work is that essentially under the job protection side, if you have fewer than 25 employees, there may not be the protection for this person to come back to get their job back because, again, the employer would have to certify that, you know, the economics and the business realities that I cannot have somebody out for 12 weeks because it would essentially ruin the economic health of my business or my company. Again, that still is being clarified, and they may have some forms down the road, but what they're asking employers to do on that, again, is a self-certification. The other exemptions, again, healthcare providers, emergency responders, an exemption for businesses with fewer than employees. And again, that requires self-certification. And the reason why, you know, you can't grant somebody, whether it's 3 weeks of leave or 4 weeks, but you can't grant them 12. The other thing I would suggest is there truly are small employers where there's literally 2 people in the office, so this is probably not realistic, and that's why they've, put these carve-outs in here. But to the extent that an employer can rotate employees and, maybe have one take leave one day, one take leave another day, this is the type of leave that can be used intermittently because it's not, involving a medical diagnosis or a medical condition. But this is the second half of this, and again, this will sunset December 31st, 2020. But yes, to answer the question, you technically can have an employee that will be out for 14 weeks, starting April 1st, which was yesterday. The other thing I will mention, and a lot of people jumped the gun on this, excuse the phrase, but if you were offering either the paid leave under the federal law or the paid sick leave under the federal law prior to April 1st, thinking that you were going to get reimbursed by the federal government, you will not. Because the law took effect April 1st, the only way you will get reimbursement from the federal government is after that date. So unfortunately, there was some bad advice that was given, not by our office, not by any of the state agencies, but there were some private attorneys out there that instructed employers, oh, you can start granting this leave the day the president signs the bill. That was not true. And so that's very unfortunate for those employers, and maybe down the road, the federal government will make some, exceptions there, but this is all going forward and not going backward. And the other issue is if you furloughed your employee or laid off your employee prior to April 1st, this law and the paid sick leave law do not apply. So and people say, well, the furlough part, they're still working. Yes, but their hours are reduced. This was intended to be a full-time, part-time employment situation, not a reduction of hours cure. So the reduction of hours cure is now the unemployment side of it. So that is why if they were laid off or on furlough prior to April 1st, 2020, the paid sick leave does not apply and the paid leave does not apply. So I'll stop. Any questions, Alexis?
Nope, there are none yet.
Okay, so let's go to the next one. So this is all on our website as well. Again, daily updates, daily changes. The U.S. Department of Labor put out some guidance, again, for employers and employees on both of these laws, the paid sick leave law, the paid leave law, the Family First Coronavirus Response Act in general. These are all on our website. Employers do have to post the notice of these new laws, and all of this is also on our website and also in the fact sheets. So we have an entire tab on our website now that says COVID-19. So you can click on that and get all of this information. And as the information becomes available and updated, I will absolutely send it to AGC so that that is passed along to all of you. So let's go to the next one, Chrislyn. So again, follow-up guidance every day. We're getting something new. So this is another posting from the Federal Department of Labor, and it also has their field assistance bulletin. And I mentioned describing the 30-day non-enforcement policy. So you may want to click on that when you have an opportunity and go on our website, and it'll give you a better idea of how they're going to approach enforcement of this. Again, there is kind of a 30-day non-enforcement policy. However, like I said, I would not recommend not implementing these laws and not providing either the paid sick leave or the paid leave just because they're technically not enforcing it for 30 days. So go ahead and go to the next one. So again, sorry to keep hammering this point, but another news release. So these literally come out daily, which is why I mentioned at the beginning to be flexible, be fluid. Some of these directives and some of this guidance could change, but again, these are all on our website, and these are federal laws. So again, the state labor commissioner technically doesn't have an enforcement arm to enforce federal laws. The impression that I'm getting from the Federal Department of Labor, just because of the magnitude of the situation is that that could change. So that is why the State Labor Commissioner has been very active in putting all the federal guidance and federal law information on our website, because we anticipate at some point we will be charged with enforcing these provisions, because again, the magnitude not only on the leave side, the health side, and the unemployment side is probably going to overwhelm not only the federal side, but many of the state agencies as well. So go ahead and go to the next one, Crystalline. Another one, again, I recommend looking at all of these because, again, they do provide good information, and it does clarify what's an emergency responder and a healthcare provider. So go ahead and go to the next one. So this came out last Friday from the Nevada Department of Health and Human Services. So this kind of addresses some of the issues I mentioned earlier about requiring a note from an employee. So the directive from the state epidemiologist basically said that employers should not require a positive COVID-19 test result or healthcare provider's note for employees who are sick to validate their illness, qualify for sick leave, or return to work. So again, the advice here is that if you have an employee who has symptoms, if you have an employee who's seeking a medical diagnosis, again, please, if possible, grant them that paid sick leave under the federal law if they qualify. It also provided guidance on individuals who had symptoms that were confirmed, or they tested positive, or they had a suspected case, and it provided guidance on when they can come back to work, when they can discontinue home isolation. So this is very specific and gives very, very good guidance about those topics. This came out last Friday. So again, they also provided additional information for household members, partners, isolated in a home that might have another household member who maybe have symptoms. So the question has come up, and the governor kind of mentioned this yesterday, is so we're very close to California, and especially in northern Nevada, you do have a lot of construction that takes place on the border, Nevada, California. You have people that are traveling back and forth to family, and whether it's girlfriends, boyfriends, wives, husbands. So again, the guidance on that is obviously if that person, whether they're in the state or out of the state, has symptoms or has been diagnosed, then the person that's been exposed to them may be required to self-isolate. The governor and the president and all the health officials have also encouraged social distancing. So obviously you can't tell people, how to run their personal lives, but I think the guidance has been is if you don't have to travel, you shouldn't be traveling. Again, there are some locations in the world where the U.S. government has said you flat out can't travel. So that hasn't happened yet, state by state, but again, I would recommend looking at this guidance, looking at the guidance from the CDC, and advising your employees to take precautions. And again, if they're exposed to somebody, then they do need to take these steps under the guidance of not only the state of Nevada Department of Public Health, but under the Centers for Disease Control. And again, as an employer, if that information is brought to you, like I said, you need to err on the side of giving them that paid sick leave, or giving them paid leave if it's available under the state law. But the recommendation from them is, again, err on the side of caution. So again, this was actually a very, very good bulletin, and I think provides some good guidance for employers and businesses on kind of dealing with those issues and bringing people back, because that is the other issue now, is there are people who've gone through the cycle, whether they've had COVID-19 or they've gone through the testing, and they are now recovered and they can come back to work, and this bulletin is providing you the guidance to do that. So go ahead and go to the next one. So this is a summary of the expansion of the unemployment benefits. I will tell you up front that the Labor Commissioner does not manage the unemployment system, does not manage unemployment benefits. We are being flooded with the overflow from the unemployment division that thinks that we handle this. We do not. However, I put this out yesterday to give a broad overview of what the expansion of unemployment is going to look like potentially in the next 3 to 4 months. And this goes back to my point about furlough versus layoffs. And I'm not going to go through this line by line by line. Basically, there's going to be additional payments of up to $600 per week, an additional 13 weeks potentially of unemployment benefits on top of the typical 26 weeks. The law also, and the governor also already suspended that you typically had to wait a week to get your unemployment benefits. That's now gone. You will be given unemployment benefits basically as soon as you're eligible. It also expanded the coverage of unemployment benefits to potentially independent contractors now. So like my cousin who's a hairdresser, she is not working, so she is now eligible for some of these expanded unemployment benefits. And back to my point about the furlough, so the reduced hours. And again, the labor commissioner doesn't enforce this, but I would encourage you, read this, go to the frequently asked questions page. But again, they call this, and I excuse the term, they call this unemployment on steroids. And I believe that this is probably going to be the first set of some unemployment benefits, and we might see another set in 2 to 3 months. But again, this is the federal government trying to address the urgent and immediate situation of, millions of people applying for unemployment per day, and to allow that unemployment to extend potentially for 39 weeks for employees. So I believe that's the last slide, Alexis, and I'll stop for questions, and if not, I will turn it over to the Division of Industrial Relations.
Okay, we did have a couple questions come through. Can an employee use the paid sick time and the first 2 weeks of the FMLA concurrently so that there's no unpaid gap?
So the intention is you can't use them both together. The intention is you use one or the other. So if there is a gap, if they have any paid state sick leave, that's how I would fill that gap. But the intention is not to allow those to be used together.
And that would be the state, just for my own clarification, the state paid leave couldn't be used as the first 2 weeks of FMLA.
No.
Okay. And then somebody just typed in, the system won't allow 1099 to finish submittal. It notes that you're not eligible. Should these people call?
So again, that's an unemployment issue, and on Monday night, the Department of Employment Training and Rehabilitation, who handles unemployment, did a press release, an announcement that they had entered into the agreement with the federal government to start providing these expanded benefits. Those forms and those boxes for 1099 are not updated yet. So they could certainly keep calling, but I do know that that has not been added to their system yet. And again, that may take some time, but the agreement was signed that Nevada would be offering these expanded unemployment benefits. It just has not been built into the system yet.
All right, super. That is all I've got so far.
Great, thanks, Alexis.
Okay, well then moving on to the next section. This is Victoria Cadron. I'm the Interim Administrator of the Division of Industrial Relations. Our agency handles all aspects of worker safety. So OSHA is part of our agency, as is our safety consultation and training section. So you'll be hearing from both of them today. We also handle workers' compensation, mine safety, and we have a mechanical compliance section that does elevators, escalators, and boilers. So just to give you a sense of our agency, Nevada Workplace Safety and COVID-19. Kelly Betts, who is our safety supervisor training in our safety consultation and training section, will be leading the presentation, and then Jess Langford, who is our interim deputy administrator as well as our head of Nevada OSHA, will be available to help answer the questions that you have along the way. So with that, we can go ahead and start with Kelly, and we can go on to the next slide. Thank you.
Good morning, everybody. So this first slide just gives you some information about the new web page or website that was built, the Nevada Health Resource. If you go to this link and you were to click on it, you could get access to a lot of different documents. This actual link will take you to the Emergency Directive 003. And inside of that, when it deals with construction, we would be looking at Section 6. This is where the governor said that the construction, mining, manufacturing, and infrastructure sectors of our state are allowed to continue working, but they need to and they shall maintain social distancing. So here we have to look at that same guidance we've been hearing over and over from many other entities, that we maintain a minimum of 6 foot of distance between each other, and in this case, the general public as well. Again, we don't want our workers and our general public in those same areas. Next slide, please. Some of the ideas that we can do, or things that we can do to kind of help us do this, if we have to transport people, we want to make sure that we maintain that same 6 foot of distance in between any individuals that are in there riding in those vehicles. If this is a single cab vehicle, that means possibly that there's only going to be one person in there. If it is a van, we're probably going to have to remove some seats and or block seating so that only a few people are riding in it to maintain that same distance. Whenever we're transporting people with these vehicles or using some type of a shuttle system, we have to make sure that we are disinfecting those areas in between each one of these moves. That way there we're not spreading things from person to person as we're doing each one of our trips. If we're working from equipment, we still want to maintain that 6 foot of distance. So if we're working in a lift of some sort and the basket is only, you may not be able to maintain 6 foot of distance. So you may be able only to allow one person at a time to get into that, which may make some of our work a little more difficult to try and accomplish, because sometimes it does take us more than one person to actually do some of the work that we do. At that point in time, you would have to look at some other type of a barrier to separate those individuals so that we're not, since we can't meet the 6 foot of distance, so we have some kind of other barrier there to actually assist us with that or separate us. Next slide, please. So Nevada OSHA has put out a memorandum on those same work areas within mining, construction, and manufacturing. This is a link to that site so that you can get all of the information from that complete memorandum. Jess Langford, the CAO, is the one who wrote this and has been posted out onto this link as well now. And you guys can have access to that. Next slide, please. Here's the basic information for all three of those different industries. We need to try and restrict meetings. If we're going to conduct safety meetings or tailgate meetings, we need to minimize the group to 10 or less. And at the same time, we want to do the social distancing protocols and maintain that 6 foot of distance in between each other. If we can't do that, then we might need to either have more meetings and downsize the group size, or look at some other options. Maybe we do things like this webinar. We do things through FaceTime, something like that, and still get the information out, but we're able to minimize what's going on inside of that realm. Next slide, please. Still talking about the mining, construction, and manufacturing. We need to make sure that we sanitize and clean any equipment and or tools that we are using throughout our day. In a little bit, I'll show you a slide that's going to have this document that's referenced on here, and this is available through OSHA.gov but I'll talk about that again in a few minutes. All of our separations need to be at least 6 foot apart. No matter whether we're in a van, a bus, in the work areas, we need to try and separate that. Or if we can't do that, we have to look at some type of a separation device to actually assist us. Management has to do daily surveys of the work sites, evaluate the staff, the work areas, make sure that the individuals are coming to work healthy and that they are maintaining these protocols when it comes to the distance in between individuals. Next slide, please. If we have first responders or EMTs on our sites, the employer needs to make sure that they have sufficient supplies of the personal protective equipment they will need to do their work. We'll also need to maintain a supply of potable and sanitary water. Again, this is just under the normal regulations, something we've already had requirements for, and we still need to maintain that. Next slide, please. Here's that guidance I was talking about. OSHA built this in the middle of last month, put it together towards the end of the month. They came out with a Spanish version of it. So now you can go onto OSHA.gov into publications and look up this link right here on the bottom of the slide and actually get access into this document. You can print it from your location or download it and then print it at a later time. But this is a great tool to use to help you go through all the steps to help us work with or combat COVID-19. Next slide, please. So this is guidance from the federal OSHA, and these are some steps we can do to try and help our workers in our workplaces to lessen the likelihood of risk of exposure. First of all, the employer needs to develop a plan to help us eliminate or at least separate us from the possibility of this disease. Once we get the document written and ready, then we can start educating our workforce in our companies to ensure that we have something written, and then we can educate them as to what they need to do to meet the guidance of this policies and procedures that we've actually put together. Again, you can use that document I talked about a little bit ago as a reference point to go in here and actually help you assist you in getting this built. We also need to have policies and procedures that let us quickly identify and or isolate anybody that we have that it comes to work sick. This is really important for like hospitals or work areas where others might be coming into our work areas, and kind of isolate them. On the construction side for you guys, it's just communication back and forth with people, and if they're showing signs or symptoms of these illnesses, we need to get them back home and get them away from the workplace so that we're not making others sick. Last bullet on there is to develop, implement, and communicate with our workforce that we're going to have some type of flexibility and or protection available. Maybe we're going to monitor everything and just do the 6-foot distancing in certain areas whenever we have to work closer to each other. Maybe we're going to put some other barrier in between us so that we can continue what we have to do, but there's a barrier system in between us, and then we're protecting people at that point in time. Next slide, please. Still on the steps to help us reduce our exposure. These 4 items are the common items that come from OSHA whenever we evaluate a hazard in our workplaces. We always want to start off with these control measures. We start off with engineer controls. Then we move to administrative controls. Then we look into the safe work practices And then our last line of defense is the personal protective equipment. Next slide, please. So when we look at engineering controls, we could do all of these or a few of these depending on what we might need to do in our actual workplaces. We might look at a better filtration system for any air or movement of air that's going through our work areas. We might look at increasing our ventilation systems in our work environment so that we have more rotations of fresh air coming into these areas. I've talked about physical barriers, something that would separate us, kind of like a sneeze guard, something like that, some type of a plastic guard that would keep us separated from others. It would help us to end the possibility of spreading this stuff. We've all seen on the news the eateries are making drive-through capabilities easier for us to get food from them. We're doing pre-orders and having things picked up, and then you pull into an area and let them know this is kind of what they're talking about. We might do this in construction with our materials that we're receiving. Maybe the materials come to our site, the individual delivering it takes off the straps and puts everything away, and then the individual that's operating the forklift would come and remove the materials, and then they would wave goodbye to each other and things would move on. That way they're not getting within that 6-foot distance, and they're keeping that separation to lessen that likelihood of possibilities going on or spreading of this. Next slide, please. Administrative controls. First thing we can do is if by chance we see somebody that's sick, we send them home. Keep them at home, and that way they can actually get better health or get over this illness that's going on. Or, and then there was other talk earlier about allergy season. Maybe it's just allergies and it's going to go away within a day or so, and they can return at that point in time. But if they're starting to get the symptoms, they probably need to contact their healthcare provider and find out what's going on with their health. Next item, minimize the amount of workers / clients and or customers having face-to-face contacts and or meetings. Most of us are doing telework, telecommunications, FaceTime, meetings like this, so that we're not all in one location anymore, to help us try and minimize the possibility of workers being close together. So we might look at things like this. It's a little bit harder to do with construction, unless it's just meetings and safety meetings and everybody's kind of off in their little work areas and they're doing FaceTime. But again, we want to make sure that we minimize that 6 foot. And we talked earlier about the possibility of having smaller groups and having meetings, but keeping that 6 foot spacing. We might look at the possibility of alternate shifts and or rotating days. In our work offices, most of us are on minimal staff right now, and we have a few people working a few days a week and or working at home, and they're doing different things. Things like that is what we can do to kind of help us with that administrative controls. Governor put out yesterday, I believe it was, on non-essential travel. I recommend to follow that. We have eliminated any travel at this point in time for us to go anywhere, to attend anything. And I think all of us should be doing that. We should all be staying at home and or doing whatever work we need to and whatever means our companies want us to do it in. I would always check the CDC website. They have a lot of good information about travel warnings and a lot of other good information to help us get through this. Next slide, please. Still on administrative controls. We want to develop an emergency communication plan, talk to our staff about our plan, how it is going to be, how we're going to contact them, how we want things to take place, and possibly even do some additional training on that if it's needed. Maybe you could do it all at once while you're communicating the plan to them and how it's going to be and how feasible it is going to be for each one of our businesses. Still on administrative controls, trying to keep everybody educated and up to date on the status of the COVID-19 risks and the behaviors. I was watching TV last night. I dare say there was about 30 quick little advertisements about COVID-19, and for more information, contact this site or that site. We're seeing this more and more, but we need to try and make sure that we're communicating everything we possibly can to keep everybody up to date and educated on this illness, and allowing them to do what they need to do to keep themselves safe and their families safe. Training the workers. With SCATs, we always end up towards the end of each one of our presentations with training. And this is where if we're going to have somebody use a particular type of personal protective equipment, they need to have training on that particular equipment. How to use it, how to wear it, how to maintain it, how to dispose of it properly, and then how often this stuff may or may not need to be rotated, depending on what we're using. Generally, it's used and discharged, but sometimes we reuse things, and then we have some cleaning that has to take place. So we want to make sure that everybody gets the training on this stuff. And all training should be conducted in a language and/or format that the worker understands. Not what the trainer understands, but what the worker understands. So you might have to have multiple trainers for multiple languages just to lessen the likelihood of somebody misunderstanding something. And again, that would follow some of the NRS requirements that exist as well. And maintain that social distancing. I know we say this over and over and over again, but there's a reason behind it, because we're seeing many people in many different situations, whether it's shopping and or on the in the workplaces, not following this the separation of a minimum of 6 feet. Next slide, please. Safe work practices. There's many things that we can do to help us. Washing our hands as frequently as we can is a good starting point. Always try and wash your hands. If by chance you can't get to running water and or soap, you can use a alcohol-based sanitizer for a period of time, but as soon as you get to an area where there is running water and or soap, you should wash your hands again. If by chance you're doing a task and you get dirt onto your hands and or your hands become soiled, or you're removing personal protective equipment and you want to go ahead and wash your hands again at that point in time. There should be signage posted about the importance of washing your hands whenever you think or you need to make contact with something. Again, you should use soap and water whenever you do that. And those signs should be in languages that the workforce, that your employees understand. Next slide, please. OSHA regulations. For personal protective equipment, it's going to fall under 1910 subpart I. For bloodborne pathogen standards, it's going to fall under 1910 1030. There could be some other standards that apply depending on what it is. If you're wearing respiratory protection, you're going to fall into the respiratory protection standard. If by chance there is no standard for the specific hazard that you're finding, it could fall back onto the general duty clause, section 5A1. Sometimes we don't have things written for certain situations, and this is a tool that OSHA uses to cover those situations. Next slide, please. Personal protective equipment. The employer needs to start off with an evaluation of the work area, try to figure out what type of personal protective equipment will be needed for the hazards that they're finding. Then they're going to have to go through and do the selection of the personal protective equipment that applies to that work that needs to be done for the protection of the employees. Sometimes we need to have fit testing conducted for these personal protective equipment items. If it's a respirator, there's some guidance out on the link that's posted here to assist you in getting that guidance and follow that information for fitting, the initial fitting test, and then the periodical changes of the fit test. We want to, as supervisors, we want to make sure that we're watching our employees, that they are using the personal protective the way it is intended to be used. I don't know how many times years ago I used to see a pair of safety glasses on the back of somebody's head, but that's not what the intent was. It's supposed to be on the front of the face, protecting the eyes, not on the back of the head and protecting the neck. So we want to make sure that those employees are using the equipment properly. If by chance we see this, then we're going to have to do some retraining if they're not using this stuff properly. Supervisors are going to have to do regular inspections. When it comes to personal protective equipment, the user needs to do a inspection daily, or every time they're putting this stuff on. If it's multiple times a day, they need to maintain this equipment and replace it as needed as it wears out and or becomes damaged. The user needs to remove it, clean it, store it properly, try and lengthen its life as long as possible. But at the same time, we want to make sure we replace it if it's starting to become worn or damaged. Again, this is also something that needs to be trained. Generally, we don't do this. Some of us have some ideas about how to do certain things all the time, but at the same time, if we add this into our training, then they'll know how to do it as we need to get it accomplished. Next slide, please. Here is a page from the OSHA.gov site. There is a lot of information on OSHA.gov to assist employers to try and figure out what they might need to do. On this particular page, there is tabs that help us do our hazard recognition. There's information on here about more additional medical information. There's links to different parts of OSHA standards that apply when it comes to COVID-19. And then there's the hierarchy of controls, which I just talked about, the engineer controls, administrative controls, safe work practices, and then personal protective equipment. Again, there's a lot more on there, but these are just a few of the tabs that I noted. Next slide, please. So here's our last slide. Again, there's a lot of phone numbers, a lot of links to websites. If you go to SCATS's website, the one on the bottom left-hand side, here you will see a lot of information, and we do put out a lot of what we call news blasts, information that's come about since the last little while, and I dare say over the last few weeks we've been doing 1 to 3 news blasts a week just dealing with COVID-19 and trying to keep employers up to date on what's taking place in our workplaces. That concludes my slideshow. I know there was a number of questions. I'm not sure, Jess, do you want to jump in and answer some of these, or do you want me to continue?
Yeah, there were some questions posted to the chat. I don't know if you guys are looking at those, or if you need me to read them, and then we had some that that were sort of offline for some clarification. And I think one of those big ones is, you know, what about when a barrier doesn't work, but people have to be within 6 feet of each other, you know, hanging a window or something to that effect? What can be done? What counts as appropriate PPE in that case?
The employer's gonna have to evaluate each one of those situations for themselves to try and figure out what they're going to do. Maybe besides normal construction personal protective equipment, maybe a respirator might be needed as well, so that it can at least protect what they're exhaling from getting to somebody else. Maybe a Tyvek suit to keep their person what is contaminated, and then gloves, some type of a glove to lessen the likelihood of them passing something on. But they're going to have to follow all the guidance that is kind of there if a barrier couldn't be put in place. Or maybe we have to do specific tasks at a later time and not install that window right now when it takes 2 people to do it. And maybe we push that back a little bit and see what happens with what's going on, and maybe later on we'll be able to have those items lifted, and then we can actually get closer than 6 feet and actually conduct those type of tasks.
Will you guys be issuing guidance on that so that there's some documentation and you know,
OSHA's done a bunch already on that, and then that memo, the memorandum that I was talking about, it does spell out some different things on there.
Kelly, this
Yes.
is Victoria. Is Jess on the line and able to answer some of these?
I asked for him a minute ago and he didn't answer, so I don't know.
Yeah. Okay. All right. So, I mean, as far as we understand, we are still having to abide by the strict 6-foot social distancing requirements. We haven't gotten any guidance that PPE would be allowed to be used as a substitution for the 6 feet social distancing. So if it's something that you can't do, our understanding is without the 6 feet social distancing is going to be something you'd have to delay until a future time. Oh, Jeff just came in. Okay, Jeff just came in. Hold on a second. I'm going to put him on speakerphone so he can speak to this. All right, go ahead.
Can you hear me now? For some reason, nobody could hear me. It's just like for Nevada OSHA. What was the question?
The question was about whether we can have PPE as a substitute for the 6 feet social distancing in cases where you're installing a window or something like that to 2 people.
That was the one I was trying to talk to. Currently, Nevada OSHA is not recognizing any use of PPE or alternative work practices for instances where you cannot do the work and you have to be within 6 feet of each other. In my directive and memo that I put out, the 6-foot isolation distance for the social distancing is a requirement at the moment. And currently, Nevada OSHA is not reviewing alternative practices or the use of PPE.
So will OSHA be issuing citations if they see 2 people then performing a task where they're within 6 feet of one another? There's some concerns from our members that, you know, that could substantially delay a project if they have to wait on some of these components. You know, that could unreasonably delay the completion date, I suppose.
And Nevada OSHA understands this because Nevada OSHA is working directly for the governor's task force on COVID-19. It has not been directed to establish any alternate means to be used in construction, though construction is considered an essential function at the moment. The idea here is to limit exposure from human being to human being, but by the dynamics for which the virus moves around. That is why the 6-foot mandatory requirement for spacing amongst individuals is in place, and it remains in place. And construction employers are expected to comply with that.
Okay, another question that we got here in the chat was that if somebody is carrying COVID, not showing symptoms, they start showing symptoms later in the day, what steps need to be taken outside of sending the employee home? You know, obviously disinfecting, but do they need to advise you guys? Do they need to, you know, call the health district? What should employers do if somebody goes home midstream with symptoms of COVID?
Currently, the Department of Health and Human Services is asking that if an employee goes home with symptoms to obviously quarantine themselves for 14 days, seek to get the test if they need to get the test, and then once the test is returned, and whether it is found to be, an exposure or not to be an exposure, whether they're positive or negative, then the DHHS has some further steps to take if it is a positive test. So that's the general guidelines that come basically from the state of Nevada that parallel the CDC's guidelines.
But is there an expectation on the employer's part? Do they need to notify anybody that somebody went home midday after showing symptoms?
I'm not aware of a requirement that they have to notify everyone in the building, but I would think that the employer needs to take the frame of mind that if potentially I have one illness, I may have multiple illnesses. The idea of the restrictions on business right now for social distancing and congregations of less than 10 and all those things is solely to reduce the spread of the virus. So I believe that businesses need to look at that exposures and what they can anticipate to be the impact on their business if multiple individuals in a location end up ill, regardless of whether it's COVID or it's the flu.
Okay, we've got another couple questions here. Is there any expectation that construction would be taken off of the list of essential businesses?
As the Chief Administrative Officer for Nevada OSHA, I have not been in any conversations yet with any of the representatives of the governor's COVID task force on the essential requirements of any kind of business within Nevada. Those decisions are all coming from that group. What I can tell you is Nevada OSHA has started taking up random surveys of construction sites throughout the state. We do that with my compliance officers, and we are now starting to address situations where we find that the social distancing guidelines are not being followed. We are now addressing those.
Okay. Do the Nevada OSHA guidance follow the sample plan for COVID-19 exposure, prevention, preparedness, and response developed by the CISC and AGC template dated 3/30/20? I believe that's a document that we posted on our website. But it's the Homeland Security, I believe, is what he's referring to, declaring construction essential. But Larry, if you could clarify what you're asking there, I would appreciate it. A second question he had was, can companies train managers, supervisors to be identified to monitor guidance and implementation for COVID-19 in the workplaces as a best practice?
Carolyn. The sample plan I'm referring to was put out by the Construction Industry Safety Coalition on March 25th and then revised by the AGC of America on March 30th, 2020. Pretty comprehensive company training template. And in that, it talks about a company identifying a team of employees or an employee to monitor the related guidance from CDC and OSHA for their workplace. And so that's what prompted my second and third questions regarding supervisory training and or assigning somebody as a competent person to do that.
So are you asking if that is a requirement in the state of Nevada currently?
Well, would it be a recommended best practice? I know it's not a requirement. I don't see it anywhere. It wasn't in the presentation, but as a best practice, is that a direction you're looking to go? Or
I would say to any business that if they want to dedicate some administration to do research and understand all the different guidances and things that are coming out about COVID-19, I think that's only going to benefit the business at this point, having better information in front of them to be able to instruct their staff with what their expectations are and what their expectations are when they're not at work, because this crisis is far-reaching beyond the scope of just being at work and trying to maintain that location. It's what we're allowing our employees to take home with them too. That's one of the reasons why the social distancing is so important. So I believe, once to reiterate, I believe that any kind of effort that a business takes on where they apply administrative skills to understanding, relaying, and training individuals about COVID is only going to benefit that business.
Okay, thank you.
Another question I've got about the 6 feet of separation when it's not actually possible. Would a visqueen barrier be, would that put a company in compliance if they built a visqueen barricade between workers that are within 6 feet of one another?
And I believe that, this is Jess Lang for Nevada OSHA again. Yeah, I believe in some instances, some businesses are using barriers to prevent the rate of exposure that each employee is going through. It would be virtually impossible to build a barrier to protect employees 100% of the time, unless you're building an isolation booth, or you want to put them in like a spacesuit or something. I mean, it's really going to be hard to do that. In the realm of construction, the building of barriers is considered an alternative method for protection at this point. And once again, just to reiterate, Nevada OSHA is not reviewing alternative methods for the social distancing requirements at this time. I've had individual construction companies saying, well, I want to put a piece of plexiglass between two people running a boom lift when they're installing building facade or windows or something like that. And I have told these particular companies that I don't believe a barrier is sufficient enough to prevent the movement of the virus, and it is more effective at this point to be at least 6 feet apart from one another. So barrier use common in some industries, barrier use in construction, obviously it can be used, but I'm not, the offices of Nevada OSHA are not reviewing alternative practices or recognizing alternative practices. Currently, only the guidelines I put out in my memo are what we're looking at and are required.
Okay, as far as hand washing stations, given that they're not readily available right now, would like an igloo type cooler with soap and paper towels be an adequate alternative to that?
I saw that question, and the requirement for potable water stands the way it's written in my guidance. In the memo that I put out, that's a federal requirement. It's a normal code that we use all the time. When I say potable water, that means it's water where an individual can use to either clean their hands, clean their food, clean the dishes they eat, brush their teeth, whatever they want to do. I realize completely that hand washing stations are hard items to come up with right now. And I know that at the governor's level, they're looking at available resources within the state, and these resources need to be moved around to different locations. So as an alternative, a water jug that is filled with water that can be used to wash your hands, I think suffices or would be adequate in the instance where you needed water to wash your hands at an increased rate so you don't spread the virus. It sounds to me like, in an old term, a slippery slope for me, because you have one individual now, or a bunch of individuals using a water jug to wash their hands from, and heaven forbid you have confusion, people start drinking from it. You know, so I think alternative practice for providing potable water is absolutely acceptable, but you have to label it well and make sure that all individuals at the site understand exactly where they need to go to get drinkable water, as compared to this is where we're washing our hands out and stuff, you know. So I'd be careful with it, but I say, yeah, I think we could probably look to some alternative practices that provide potable water for construction sites.
Okay, and the only other question that I sent you guys that hasn't been addressed is, the health assessments, we actually sent out sort of a questionnaire that employers could use, and then if any employee answers yes, what are you guys' thoughts on doing health assessments before a shift?
Can you repeat that? We had trouble understanding the question.
Sorry. Trying to find it here as it's written. Your thoughts or comments on performing daily health assessments?
In the memo, I did require that daily health assessments of some kind be completed. It's under an emphasis under construction, basically to understand what is going on with staff. Some construction sites do daily entry gates where everyone's temperature is taken as they come through the gate. So they're looking for elevated temperatures in the human body. It could be as easy as just understanding your staff and talking to them a little bit about what's going on, personal life going on at work, you know, because once again, this is it's a statewide problem. It's a statewide crisis. So it affects families, and whatever is affecting the family may be transported to the business's work site, let alone construction site. The reverse of that also applies too. So I think the idea under the general guidelines of OSHA is to have some process to survey staff as they're coming in and be connected to staff well enough to know that they are they're okay, they're not having any symptoms of any kind, and then if they find that they have symptoms or their health changes drastically over the course of a workday or the course of one evening when they come back to work, there's a way to administrate that and understand that that's happening so that that person can be relieved of their duties, sent home, so that whatever they got can't be spread amongst the workforce.
Okay, thank you. We just got another question. As a subcontractor, we are at the mercy of the owner in general, bound by contract. Is OSHA working with owners and GCs to relax schedules for completion dates? In other words, we have to get the work done regardless of OSHA recommendation on windows or other tasks should be done. Not up to the subcontractor, but if the subcontractor is at risk of OSHA fine, not the owner of the GC.
I thank you for the question. I can tell you that Nevada OSHA is focused on the general contractors and the owners of these construction sites. They will be the first person we contact if we're finding non-compliant situations on the work site. And then we will look to the subcontractors that are also under the general responsibilities as defined. So GC first, general subcontractor second, and when it comes to doing tasks where you cannot possibly separate yourself and continue to move forward with the construction project, that is the decision of the GC and the subcontractor if they want to do that. All I know and what I can tell you is if I provide too much information to the governor about construction sites not complying with the general requirements of social distancing, he will make a decision to make that happen. So, like I said, Nevada OSHA is working closely with the task force for COVID-19 that the governor has in place, and that's the orders we're marching to at the moment.
Okay, that's the last question that I have here in the chat. Somebody did ask if they're going to get a copy of this PowerPoint. I believe that the PowerPoint was sent out to all of the participants that RSVP'd for this call, but we've been recording it, and as soon as we can figure out how to post this on our website, the recording and the PowerPoints will be there. But I just ask for participants to be a little patient with us, as this is the first time that we're recording and posting one of these meetings. That might take a day or two. Okay, I'm not getting any more chatter over here in the chat group. So I just want to thank OSHA and the Labor Commissioner for doing this for us. I hope it helped our members. And I know that things are really dynamic and fluid right now. So patience from everybody is appreciated. And thank you so much for for doing this for us.
Thanks, Alexis. Thank you
Thank
for
you.
having us.
All right, stay safe and be well, everyone.